Hi guys, so I think we can get started. Um, we will be recording today's session and I'll be posting it on YouTube, so be mindful of the name that you appear on your login and your video images and any personal information that you may think about sharing when asking questions and stuff. You can use your reaction emoji or raise your hand or type in chat if you have a question. My name is Lauren and I'm a 12th grader in Cooper City High School. I've been in Girl Scouts since kindergarten. And today's session is a part of my Gold Award project, which is focused on educating young women about their health as well as information about cancer and steps we can take to prevent or identify cancer signs early. I'm inspired to do this project in memory of in honor of our former co-troop leader, Miss Antonella, who unfortunately had a late-stage cancer diagnosis and passed away a few years ago. We love her very much, and we wanted to do our best to learn how we can stay healthy, happy, and live our best lives. So we can move forward with our session goals for today. We have two guest speakers, a trauma research and analysis clinician, Doris Cowell and Kara Clayton. They will share some information with us about her education, areas of expertise, and different types of cancer screening, and most importantly, how we as women can take better care of ourselves. They'll have some prepared slides, and we should have some time for some questions and answers at the end. So if you guys would like to introduce yourselves.
Sure. Hi, this is Doris Cowell. Myself and Kara Clayton, we're very happy to be here. We hope that you learn some new things today and that you can take that information and then use it in your daily lives. One of the things that I was very passionate about was oncology because I was in it for over 20 years as an oncology nurse. It was general oncology, so there were different types of cancers that we saw here at the hospital. I work at University Medical Center. It's in Las Vegas. We are a county hospital. And as of a few years ago, we no longer had our oncology program. So that's why I'm in trauma research right now. I went to UNLV, or University of Nevada, Las Vegas, where I got my Bachelor's of Science in Nursing. When I first started out as a staff nurse, it was in oncology. And then I became a chemotherapy biotherapy certified nurse. And then about 3 or 4 years later, I became an oncology program coordinator. And we used to have an approved program by the American College of Surgeons Commission on Cancer. So I was not only the program coordinator, but also the clinical manager over that program. I was also a chemotherapy biotherapy instructor for 10 years with the Oncology Nursing Society, and I became an oncology certified nurse during that time. So I'm going to turn it over to Kara, who can give you a little bit about herself as well.
Hello, my name's Kara Clayton. I am a registered dietitian also at UMC Hospital in Las Vegas. I started as a dietitian here at UMC. I also graduated from UNLV with a Bachelor of Science in Nutrition. As a dietitian, you need to do a didactic program. So I did that with UNLV. However, I was at St. Rose Dominican Hospitals when I was interning. I then was hired as a full-time RD in 2015 at UMC, which kind of coincided with my career here because I started in the kitchen in 2008 serving the patient trays. So I've been at UMC for a very long time, and I was working here in the kitchen while I was getting my degree in nutrition. So that was definitely helpful in my clinical rotation, that I was comfortable speaking with patients and used to being in the hospital setting. I started at UMC in 2015. Like I said, I started in med-surg units, which are kind of just the run-of-the-mill inpatient population, nothing too complicated. I then transitioned into pediatrics and pediatric ICU. I also covered IMC, which is intermediate care. So I was getting more clinically stressed patients, I guess you could say. after doing a few years, about 5 in pediatrics and IMC, I moved into oncology and burn care, which are very nutrition relevant areas of expertise. And it was really where my heart was in oncology, and my heart still is in burn care. Since we did have our oncology program no longer here at UMC, I did continue my work with burn care, and then I do still see oncology patients in the hospital when they're admitted. My areas of specialty are, like I said, burn care and oncology, and I've been a dietitian for 10 years.
Okay, this would be
Thank you so much.
You're welcome.
Who was starting? Was it Doris or?
Nope, it's me, it's Kara.
Awesome.
And I guess I'll just tell you next slide when I'm ready.
Okay.
Okay, so for nutrition, I think that one really relevant area of topic is phytochemicals, which are plant chemicals that are in fruits and vegetables. These chemicals do have a role in fighting some disease in regards to antioxidants. And then they also have a role in helping prevent disease in regards to fiber. So we do know increased fiber can reduce risk of colon cancer. And that's something that's definitely well studied. And then phytochemicals can increase the activities of enzymes that can help in destroying free radicals and carcinogens. So eating a variety of fruits and vegetables is very important because they contain different phytochemicals so that you can get a variety of those chemicals. And of course, you should be eating a variety of fruits and vegetables at baseline. So in regards to antioxidants, those are molecules that have an uncharged molecule that is like an unpaired electron floating around that molecule. And so that makes it unstable, short-lived, and highly reactive. So it kind of runs into your other cells and can cause cell damage. When you have antioxidants that you're consuming in your diet, it gives up their electron and makes that free radical neutral. Next slide. So some examples of phytochemicals would be the antioxidants, like I mentioned, the carotenoids, isoflavones, and catechins. So the carotenoids are high in carrot and sweet potato. The isoflavones are high in soy, legumes, and nuts. And catechins are high in berry and tea. So those are some examples of foods where you can get those extra vitamins, minerals, things from your plant foods to give you some extra antioxidants and extra protection. I also wanted to discuss supplements in regards to this presentation because I think that in this day and age, there's a lot of stuff out there in regards to what supplements you can have. And I think it's important to explain to you guys that your body does prefer to get the nutrients from food, not necessarily pills. So if you have a good variety of fruits, vegetables, fiber, you're going to get the nutrients that your body just is demanding of you. And also, pills don't necessarily have the bioavailability that you would get from a food. So you can only absorb so much of a nutrient, and then you're going to excrete the extra in your urine and feces. So sometimes I say when you're getting all of these supplements, you're just making really expensive urine. So you can only absorb so much. You're more likely to absorb 100% of that vitamin or mineral if you're getting it from your food rather than just a pill form, if that makes sense. And so, it might not be necessary to have those supplements, and it's really just an added cost you might not benefit from. And I think that it's important when you're looking at things that are on TikTok or social media, see who the source of information is, because a lot of those people do get like bonuses in how much of a product they sell. Whereas a registered dietitian like myself, we're held to a code of ethics, and we have to make sure that we're giving the best best information for the patient at that time, and we're not making extra money by pushing these types of supplements. So basically just have a healthy level of skepticism when you're online and you're seeing things like that. Next slide. Oh yeah, and eat the rainbow. Thank you. Okay, so I think that in the best advice I could give you is to try to limit fast foods and high sugar drinks. So eating really processed foods are going to be really high in calories, and the more calories you're consuming, the more weight you're gaining. That is indirectly linked to cancer, so it can increase your risk. These things are going to be higher in sugar, sodium, and fat because those are preservatives. So when you have a fast food type of meal, or you're having something that you're getting off the shelf in a package, that company is wanting that product to stay shelf stable for as long as it possibly takes to get sold. So it's going to be higher in sugar, salt, fat. It can lead to weight gain, and obesity can increase your risk of cancer. And I talked about that. So, and also try not to choose sodas from like drink machines and that type of thing. I recommend doing like iced tea if you can. Water is even better. But those added sugars are indirectly linked to cancer, again, because it can lead to weight gain, not necessarily because of the sugar in the drink is going to like feed a cancer, which is something I have to debunk quite often with my oncology patients, but because the increased calories are going to increase your risk of weight gain. Rebecca, energy drinks, I'm not a big fan of. They're going to increase your heart rate. That's another risk in regards to your cardiac function, but also they're likely high in sugar as well. I know that there are sugar-free substitutes, but I would rather not do an energy drink. And then I know it's difficult to say never consume these items. I know that that's not realistic. I know that you're going to be out with friends and doing things that maybe the fast food restaurant is your only option. Just limit your intake. I'm not saying never have these things, but try to limit your intake. Don't make them an everyday sort of consumption. Okay, red meats and processed meats. So red meats such as beef, pork, venison, lamb, and other red meats have been linked to colorectal cancer. This doesn't mean you can never have it again. It just means to reduce the frequency and choose smaller portions. So, for example, the recommendation is to limit 18 ounces of red meat per week. So it's not that you can't have it, it's just that you shouldn't be having it for every single meal. Processed meat is linked to increased risk of colorectal and stomach cancer. This refers to any meat that has been preserved or has undergone changes to its shape or flavor. So like bacon, hot dogs, things that are really highly processed. Again, these are going to have really high preservative content as well, like I spoke to on the last slide, which is going to be sodium, fat, and that type of thing. Cooking temperature also puts a role in increasing free radicals. So char grilled meats have more potential for carcinogens than items prepared in lower temperatures. Like sous vide is of course going to be the lowest risk, but baking is going to be better than a char grilled. So avoid that burnt hot dog at the cook-off if you're going to one, and try to do one that isn't going to be burnt or have that black carcinogenic outside, because it's going to be an increased risk. Okay, and then what about inflammation? I think that that's a really high talking point in like social media and stuff that I've seen these days. So inflammation, foods do not cause inflammation, but there is a caveat in being that celiac disease and irritable bowel disease, that is going to cause inflammation in the types of foods that those patients are eating, but that's a chronic condition. So not everybody is going to have a reaction to certain foods like those with celiac disease or irritable bowel disease. What we do know that causes or drives chronic inflammation that will increase cancer risk is excess alcohol consumption, tobacco use, sedentary lifestyle. So this is like never moving your body, that you're not trying to take a walk and get your steps in that way. And then excessive body fat or a metabolic dysfunction. So that can increase your risk. Smoking increases the risk of free radicals, and obesity, that increases hormones which are pro-inflammatory and also correlates with insulin resistance. So what's the takeaway? I don't want you to think that there's bad foods that you can't eat. Certain types of foods, you've got to limit some of them. And it's all about balance and getting a well-rounded diet. Always incorporate fiber, fruits, and vegetables into your meals. That's the best advice I could give you guys to reduce your cancer risk. Next slide. And then yep. And then how can you decrease your risk? So getting your 5 a day. This is 5 fruits and vegetables in a day. When you're doing juice, try to get 100% fruit juice, but you want to limit that to half a cup per day. If you can, try and add fruit to cereals or top it on pancakes, or just incorporating that into your everyday intake. And if you're having a difficult time getting 5 a day of your fruits and vegetables, you can try incorporating it into a snack or a dessert. Add lettuce, tomatoes, sprouts, microgreens to sandwiches. Those are really good ideas. And then frozen, canned, and dry fruits and vegetables, they also count as your 5 a day. So those are also good choices. Getting salads off of a salad bar, I always recommend trying to get a salad in to your lunch or your dinner if you have that option. And then low sodium vegetable juices. So like V8, for instance, is really high in sodium, but they do have a low sodium option. And then adding vegetables and casseroles to pastas and pizzas. I remember when I was going through college, I mean, I could barely afford to get that good of food, but I would get like a box of hamburger helper, but I always added vegetables to it just to try to get something. So I understand that budget is an issue, but trying to incorporate fruits and vegetables is possible. And you can always talk to a dietitian to try to get some tools to increase that intake. And then also you can snack on dried fruit is another good option. Next slide. Okay, so increase your fiber and complex carbohydrates. So that's your grains, legumes, roots, tubers, plantains. Those are going to be the really high fiber intake. So look for things that say whole wheat, barley, rye. Whole grains are going to be more fibrous and they contain more minerals and vitamins than their white grain counterpart. So for instance, when you have white rice versus brown rice, when they make white rice, what they do is they put it in this huge tub and they spin it to get that fiber husk off of the outside of that rice. Now, the problem with that is that's all the fiber and the minerals and vitamins. So, you know, you've got the carbohydrate in the rice, but you've lost all of the fiber and the minerals and vitamins. So that's why brown rice is better than white rice. The same with whole wheat rather than white bread. Look at your label. It should say whole grain before the name. And then, you know, this is good because like I explained the husk. And then looking for breads with more than 2 grams of fiber per slice, and look for cereal with more than 6 grams of fiber per serving. Okay, and then I thought I could give you guys some information about what diet we do know that is good. Now, typically I recommend that you guys try to work with your average diet, cultural lifestyle, but just adding more fruits and vegetables in it. But sometimes people want to know what diet is good for me. The Mediterranean diet does have really good data in that it's good for us. It lowers a lot of our cholesterol intake, and it has a lot of antioxidants in that fruits and vegetable recommendation that I gave you. So it's plant-based. And it provides really good fiber, healthy fat, really good lean proteins. And then you're getting more vitamins and minerals because of the fruits, vegetables, and fiber. Aside from all of that, it's also typically lower in calories, sodium, and added sugars because you're getting more fresh, whole foods. And then remember, your best resource for nutrition recommendations is a registered dietitian. We do have at minimum a bachelor's degree in science and nutrition, and we have really comprehensive knowledge in clinical and general nutrition. I think that there's a lot of times I notice when I'm in a gym that there's somebody giving somebody nutrition advice and they're not necessarily qualified. A dietitian is somebody who is looking at your clinical labs, your past medical history. We're taking everything into account to give you the best advice that we can. So unless somebody is holding the title of an RD on TikTok or Instagram, I would kind of pause on what exactly they're recommending for you, because anybody can call themselves a nutritionist, but only a dietitian can call themselves a dietitian. And we have that knowledge to back it up.
I have a question too.
Yeah.
Does anything that we eat or drink affect acne?
I know that you guys had asked about that in our emails, but the thing is, I just don't really specialize in that, so I just don't feel comfortable giving the advice for
Okay,
that.
no worries.
Yeah. Okay, physical activity. So starting movement is the best and the first step that you can make. So sometimes getting started is the hardest step. So giving yourself small, achievable goals are going to be your best thing for accountability. So, make it easy on yourself. You can't go gung ho, because then you're going to be sore. You're going to want to take a break. So starting small is going to be really good for you. The recommendations are to get at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity activity per week. And then if you do notice that you're having any issues after starting your physical activity, make sure you're letting your doctor know if it's really limiting your ability to move. Like that's definitely a problem. You should let them know. Making a plan achievable goals. So, you could start with 15-minute activity and then add 5, 10, or 15 minutes over the next several weeks. So you really want to get a goal of 30 minutes per day is like the minimum. And that can be just taking a break and taking a walk after a meal, after dinner. Or if you're early, I know it's going to get really hot and morning is going to be the best. You could get up early and try to get a few minutes of walking and moderate activity in. And then keep going, be consistent. You can find a group of friends to be active with you. And that can help with your accountability goals, or just somebody that is excited for you to start those goals and that you can share with them your progress. But basically move more and sit less is the recommendation. Okay, so as a reminder, I just want you guys to know that no single food can cause cancer and no single food can cure cancer. Supplements are not always necessary. Food should be enjoyed and never burdensome. So I want you to be able to incorporate these recommendations into your life in a way that you're looking forward to. And the good news is that fruits, vegetables, and whole grains, they're really dense in vitamins, so you don't need to have those pills or anything like that. And I think that it's really important to understand that many studies have been done on cancer prevention and causation when it comes to dietary components. And it's important to understand that these studies looked at all cancer cells in a cancer cells in a laboratory, or maybe in like an animal model. So sometimes that does provide good evidence, but you really need human studies to understand what exactly is going to affect a human. So when reviewing these studies, it's worth noting very few they're done on human populations, and they're not able to show definitively that a dietary supplement or component would cause cancer or protect against cancer. So the correlation is not always causation, is what we say in the field. And especially in regards to like nutrition type supplements and studies, it almost always says at the very end, with a combination of diet and exercise, participants saw X amount of weight loss. Now, you could get rid of whatever supplement they're typically pushing and just stick with the diet and exercise.
Okay.
All righty, I'm gonna pass it off to Doris.
Okay.
Thank you, Kara.
Okay. So if I can just start out by saying that when we're talking about cancer, we want to make sure that the information that we're gathering is going to be trustworthy, because there's a lot of information out there that has not been tried and true information that we're receiving. So there's 3 websites right now that I know you can go to and feel comfortable that they are trustworthy websites, which is the American Cancer Society at cancer.org, the National Comprehensive Cancer Network, which is the nccn.org, and then the National Cancer Institute, which is cancer.gov. And like I said, these are trustworthy websites. They have a lot of information. It's great information, and it's easy to read. I think it's great for the layperson who doesn't know anything about medical terminology. I think they put it into vocabulary that everybody can understand. Okay, next slide. So what causes cancer? So when we look at the American Cancer Society, we see that 1 in 3 people in the United States will be affected by cancer. And when you think about it, our bodies are made up of so many cells, and that over our lifetime, they will grow, divide as needed. So, cancer does begin when healthy cells do not stop dividing. Our bodies are programmed, it's called apoptosis, and that apoptosis is a natural thing that causes our cells to die off when they're no longer needed. But in cancer cells, that is all turned off. So those cancer cells are not only rapidly dividing, but they're typically dividing and spreading into other areas of the body. So, cancer starts when something goes wrong in this process, and abnormal cells crowd out those normal cells, making it harder for our body to do the job it's supposed to do. Each one of our organs has a specific job to do, and if that organ is not, if the cells in that organ are not properly dividing and dying off, then the cancer can start, and that organ doesn't work like it can function like it should. Okay, next slide. So I'm just going to go over some cancer facts for women. We're going to focus on breast cancer, cervical cancer, and skin cancer, because in the essence of time, I do want to, touch on these topics here. And I can spend a whole day going into each individual cancer that you see on the screen right now, but I just wanted to mention that with breast cancer, there's 1 in 8 women who will have invasive breast cancer in their lifetime. And what we mean by invasive breast cancer is that breast cancer can spread to other areas. So it's gone beyond the original site, beyond the borders that we would like it to, and it can spread to other areas of the body, other distant sites. Like, for example, with breast cancer, it can go to the bone, it can go to the brain, the lung, the liver. So that's what that means by invasive breast cancer. With colorectal cancer, this is cancer that starts either in the colon, okay, or the rectum. And when we look at the statistics from the American Cancer Society, we see that women will, in 2025, there's an estimated number of cases of 71,810, which is about 7% of new cases of cancer. And then of those, about 8% will die of that colon cancer or rectum cancer. And the reason why is because what happens is people don't necessarily go and get screened like they should. Because if we can find some things early, people don't have to die of these diseases. So, just putting that out there. With lung cancer, this is the second most common type of cancer in women in the United States and the leading cause of cancer death. It's, depending on the culture that people come from. Like, for example, Asian women in their 40s, we see more common lung cancer, and they've never smoked. So we don't necessarily know why that happens, but that can happen in that particular culture. When we look at lung cancer, this is also in the bronchus. For females, there's 115 115,970 cases, which is about 12% of new cases for lung and bronchus cancer. And then of that, about 21% of those women will die of that cancer. And it's something that we don't necessarily get screened until we, go to the doctor and something's wrong. We do recommend that women or men that smoke and have a history of smoking, they're at increased risk for lung cancer. And at about age 50, they should start getting screened if it's beyond 20 years since they quit smoking. Okay, and then looking at cervical cancer, we see that about 13,360 new cases of invasive cervical cancer will be diagnosed, and about 4,320 deaths in the United States will happen with cervical cancer. And then almost all of the cervical cancer is related to what's called the human papillomavirus. And we'll talk a little bit about that in just a second. Endometrial cancer, this is, it's a cancer of the lining of the uterus. So that's the inside of the uterus where, babies are developed. And we see about, we see about 69,120 or 7% of those cases that are new cancer diagnosis will be a uterine cancer. And then about 5% of those people will die of that disease. One thing with cervical cancer is that we have the pap smear. So that's something that we can go and get checked and screened for. So we do find more people are dying of uterine cancer than cervical cancer. When we look at ovarian cancer, the most important factor is age and family history of breast cancer. So we see that usually it's an inherited gene, like the BRCA1 and BRCA2, or Lynch syndrome, which is another type of inherited gene mutation or variant. And it's often called, the Lynch syndrome is a hereditary non-polyposis colorectal cancer. It's an inherited disorder that increases the risk of many types of cancer, not just ovarian, but it can also increase the risk of colon cancer in the large intestine and rectum, and also, other types of cancers in the stomach, the GI tract, gallbladder, liver, urinary tract, brain, and skin. So just to put that out there. And then the frequency of Lynch syndrome is about 1 in 279 individuals who have that genetic variant. When we talk about, I'm going to go back to, if you just one more time, I'm sorry, the skin cancer, we're going to talk about that as well, because this is the most common type of cancer in the United States and affects everyone of any skin tone. So even though some individuals may have darker skin, it doesn't mean that they won't get skin cancer. They have to protect themselves as well. So, okay, we'll go on to the next slide. So when we look at breast cancer, we look at, the risk factors, right? So we have 3 modifiable risk factors, which actually Kara had touched on, is our weight. So, we want to keep our weight down. The weight, the heavier we are, the more we have a chance for that inflammation to develop. And then the sedentary lifestyle can set in. People are usually less physically active. Also, alcohol consumption is another one. We want to limit our alcoholic beverages because that can also cause inflammation as well. Breast cancer is the most common cancer in women in the United States, except for skin cancer, and it is the second leading cause of cancer death after lung cancer. Risk factors, again, they're going to go up as women get older. And then every woman should know what their risk factors are for breast cancer and how to minimize those risks. Okay, next slide. So when we look at the breast cancer risk factors that we cannot control, these are the hereditary risk factors. So about 5 to 10% of breast cancers are thought to be hereditary, meaning that they result directly from a gene variant or mutation, which is passed on from a parent. So it's good to know our family history. First-degree relatives like a mother, sister, or daughter with breast cancer, it doubles our risk of getting that cancer. And then having two first-degree relatives increases the risk by about threefold. So that's important to know. The BCRA 1 and 2 or BRCA 1 and 2 gene variation, it has up to a 7 in 10 chance of getting breast cancer by age 80, and it goes up if more family members have been affected. There is one of the things we look at is the early onset of breast cancer, usually greater than age 50. If a woman has had ovarian or fallopian tube cancer at any age, breast and ovarian cancer in the same woman at any age, and then the Ashkenazi Jewish ancestry with breast or ovarian cancer at any age, bilateral breast cancer at any age, and then sometimes males can get breast cancer as well, and so breast cancer at any age for male, and then the triple negative breast cancers and ductal carcinoma in situ at any young age. So these are some of the things we look at in terms of risk factors. And I just want to talk, before we move on to the next slide, I did want to talk about a little bit about the BRCA 1 and 2 gene. So when we think about those genes, they actually produce proteins that help repair our damaged DNA. Our DNA gets damaged every single day that we are living. It gets bombarded by things in the environment, by the sunlight, by the things we eat that may not be good for us, and other things that might be causing our DNA to be damaged. When we go to bed at night, our bodies, when we get our sleep, that DNA helps to repair our DNA. So what happens is this gene, unfortunately, causes it becomes a mutation or a variant, and it increases our risk of breast cancer and also ovarian cancer as well. And just to keep in mind that everyone has 2 copies of each one of these these genes from one copy of the inheriting parent from each parent. And then also, when we think about it, in female breast cancer, more than 60% of women who inherit a harmful change in the BRCA1 or BRCA2 gene will develop breast cancer during their lifetime, by the contrast of about 13% of women in the general population who will develop breast cancer during their lifetime. And then let's see what else. Okay, I think we can go on to the next slide. Okay, and looking at our breast cancer prevention and screening, one of the things, women really should get to know their own bodies, because when you go to the doctors, like when you start to get screened, like every year or every 3 years, depending on your age, that doctor is only going to see you once, and you get to know your own body. So what we're recommending is that women get to know their own bodies. Usually it's good to do, your own self breast exam, just to, when you're in the shower, get that soapy lather, just go over the entire breast to see if you can feel anything that might be like a lump or, something that doesn't feel normal. And then usually we recommend that women do that a week after their period or their menstrual cycle, because the tissue, the breasts are not sore. So you can get a little bit deeper when you're looking for possible signs of a lump. So when we look at women ages 40 to 45, the American Cancer Society recommends that we have a choice to start either yearly breast cancer screening with a mammogram, or we can wait to the ages of 45 to 50, which they do recommend that a woman gets a mammogram every year. And then women 55 and older, they can actually switch to a mammogram every 2 years or continue annual screening. And again, we want to make sure that we keep in mind that this is for average risk for breast cancer. So again, if you have one of those, if somebody has one of those inherited genes, then that individual is going to want to get checked a lot sooner and a lot earlier than age 40. And then screening should continue as long as a woman's in good health and expected to live for at least 10 years. 10 more years. Let's see. Okay. We can move on to the next slide. Okay. So just kind of looking at signs and symptoms of breast cancer. Usually it's in the form of a lump. Now this can be in the breast itself or under the armpit or the axilla. Sometimes the lumps are so deep within the breast that, and it has spread already to the lymph nodes underneath your axilla or your armpit. That's normally where it spreads. It spreads into those lymph nodes. And then again, these lumps could be superficial, which is close to the surface, or deep. There could be what's called an orange peel. Like if you think about an orange and the peel that's on the outside of that orange, it could look a lot like that. Inflammatory breast cancer could have that orange peel looking to the skin, as well as redness and swelling. Now, there could be pain associated, especially with inflammatory breast, or there may not be any pain at all. Sometimes there's, women can sometimes see bruising, looks like a bruise or discoloration of the skin. Those could all be signs that something's, it's abnormal. So we want, women to go out and get that checked. Okay, next slide. So I received these images of mammograms, and I'm sharing them with you now. We can see that the top, up here on the top, we see that this is, each side of the breast. So there's a left and a right breast, okay? So there's different views that are done when mammograms are done for women. There's what's called the mediolateral oblique. So the woman is, and then this is the left breast, okay? And then we see that, or I'm sorry, on the left side of the screen, that's when the breast is up against, standing up, and it's up against putting their arm up, and it's up against the X-ray machine. And then we have what's called the cranial caudal, which is on the right side here. This is when they take a view from like the head down, or I'm sorry, yeah, the head down. They start out, the beam actually of X-ray goes down from the top to the bottom, okay? Now, there are 2D and 3D images of mammograms. Most of them are 3D now, which is giving us more, it gives the radiologist more information from the image that they can see with the breast tissue. Other things that could be done for imaging are breast ultrasounds or breast MRIs. Sometimes when younger women, find something on their breast and they go to have like an ultrasound done instead of an X-ray, which is your mammogram. Mammograms are X-ray. So instead of exposing younger women to a mammogram, which has X-rays in it, they may want to opt to an ultrasound. And then in women who do get a mammogram, the ultrasound could actually help to see if there's something solid there or something that assists, okay? And then MRIs, they all kind of tell a little bit more about the tissue. So that might be something else the doctor wants to look at as well. Now, when we look at the bottom picture, we see that this particular picture is showing cancer. So the circles are showing that there is actually breast cancer in this in the breast. And if you look to the on the left side, you'll see another circle at the top here. This is the left breast, but what we're seeing is actually bone. You can see that there's a spine here, and then it looks like there's actual, actual cancer inside the bone, which I was saying earlier. That is actually a metastatic breast cancer. So the stage is stage 4 at that time. So this is a fairly large cancer that we see on imaging. Now, I just want to put it out there. I'm not a radiologist and I'm not a doctor, but I can tell just by this information, by the imaging here, that this turned out to be a breast cancer. Now, the treatment will be determined based on the cancer size, the actual stage of disease, and the type of breast cancer. So if there's a larger breast cancer, or tumor, the doctor may opt to do radiation first to shrink it, and then come back to do chemotherapy to get rid of the extra cells that are left behind. Sometimes doctors will opt to do chemotherapy first and then radiation. Sometimes doctors will do what's called surgical procedures, a lumpectomy, which is a smaller part of maybe taking that tissue on one of the breast, which is a smaller piece of breast tissue than it is with a mastectomy, because that takes the whole tissue, the whole breast. And then hormonal therapies are treatments that help to keep hormones away, such as estrogen, to which may be driving with the cancer to grow. So they try to eliminate the estrogen as much as they can within the in the body, so that cancer doesn't keep continuing to grow or come back. And then there's a combination. There's also called targeted therapies. These are actually, if you think of your healthy body as a garden, and your immune system is the soil. When you're healthy, the soil is able to prevent weeds from growing out of control, right? So if we think about targeted therapies, these weeds are directly sprayed with the weed killer, okay? And then, the good plants may be damaged as well. So any of these things that we do, other than the hormonal therapy, could damage your good cells as well. But your body recovers, okay? The body recovers. And so those healthy cells won't be affected once the treatment has stopped. We also have what's called, let's see, I think I went through all of that. Okay. Oh, there's immunotherapy, excuse me. And this is, instead of targeting the weeds, the immunotherapy helps to fertilize the soil, enriching it to help the weeds grow. So it helps our immune system, works with our immune system to keep the healthy cells, but to keep away the cancer. Okay, we can move on to the next slide. Okay. So let's just move on to cervical cancer right now, and we're going to talk about prevention and screening. So again, according to the American Cancer Society, we see, when I was going over those statistics, we see, about 13,000, over 13,000 new cases of those invasive cervical cancers will be diagnosed, and about 4,000 or so women will die from cervical cancer. And again, it's the most frequently diagnosed cancer in women between the ages of 35 and 44, with the average age of about 50. And it really develops in women younger than age 20. Most times it's because of the HPV virus. It is a very common infection that we see that spreads from skin to skin contact with infected body parts. Most people don't even know they have HPV. And a lot of times they can clear this on their own. However, there are variants of the HPV virus that cannot be cleared. There are higher risk type HPV types. These are HPV 16, 18, 31, 33, and HPV 42. So they give them numbers so that they can kind of delineate, low risk from high risk. And then the American Cancer Society does recommend that all children get the HPV vaccination between the ages of 9 and 12. When the vaccine works, it works best during this age of development. But children and young adults can still get the vaccine up to age 26. Vaccinations are recommended. Vaccinations at the recommended ages will prevent more cancers than vaccinations at older ages, maybe because our immune systems are a little bit different as we get older. If you're between the ages of 27 and 45, you may want to talk to your doctor about getting the vaccination. Okay. Now, if you have your cervix removed, can you prevent cervical cancer? Yes. Yes. You don't want to get rid of your cervix unless you don't want to do that unless you're, unless you have a high, well, let me just put it this way. You don't want to do anything with your cervix to prevent HPV. That's, but if you have, you don't have your cervix anymore because you had a hysterectomy, then you're not going to get it that way. Okay. Okay. Having regular screening tests can find changes in the cervix that can be treated before they do become cancer. There are changes within the cells in the cervix, and it may not even be from HPV, but the doctors, when they do the pap smears, they can actually look at those cells under the microscope and to be able to see if they're seeing any changes that might be leading towards something that could be a cancer. And so they may want to do like procedures or something to get rid of those cells so that they don't continue to develop. And the pap smear test looks at, like I said, the cells of the cervix to find those changes. And there are what we call precancerous lesions that they see. And again, they can go ahead and take those off at some point with the gynecologist. Regular screening can find cervical cancer early when it's small and it has not spread to other areas. And it's much easier to treat when it's found early. And same thing with other cancers. Okay, so if we can move on to the next screen. With skin cancer prevention and screening, we want to say that this is the most common type of cancer in the United States. When we think about our skin, it's the largest organ in our body. Anybody with anybody can get it, any skin tone, and it's one of the easiest cancers to prevent or find early. It's really the ultraviolet radiation from the sun causes most skin cancers. Tanning booths, sun lamps also expose us to UV rays that can cause cancer. The weakest rays are the UVA rays, and they have the longer wavelengths. So what I did was I put this picture here so that you can see that here's the sun at the top. I don't know if you can see me pointing, but here is the UVA is on longer rays, and that's most of the rays that come down. 95% of those rays are going to come down to our surface here. And this is what causes aging of the skin. Okay, so think of age as aging, causing wrinkles. The UVB rays are only about 5% coming from the sun. However, they are stronger wavelengths. And actually, they cause direct damage to DNA. And only about 5% of those rays, like I said, are coming, reaching the surface of the Earth. UVC rays are the strongest rays, and they are found high in our atmosphere in the ozone layer and do not touch the ground at all. Yeah. Okay. So I just thought I like to show this so that you can kind of get a visual of those different types of rays that we have. Okay. Okay, moving on to the next slide. Here we go. So the most common types of skin cancer, there are other types of skin cancer that I didn't want to get into today, but these are the most common ones. We have a separation between melanoma and non-melanoma, okay? Because melanoma is a little bit of a different type of skin cancer. Non-melanomas are found on sun-exposed areas of the skin, and they include the face, ears, neck, lips, and back of the hands. And most of cancers of the skin, most of which are the basal and the squamous cell, and they are by far the most common of all types of cancer in the United States for skin. And according to one estimate, about 5.4 million basal and squamous cell skin cancers are diagnosed every year in the United States. And about 8 out of 10 of those are basal cells. So basal cell carcinoma is one of those skin cancers that we see the most. And then there's less frequent squamous cell skin cancers. What I wanted to do is show you a picture of our skin. So if we cut our skin, that block that you see at the very top where you see the hair shaft, that's like the outer part of your skin that you can see. And as we get into those deeper layers, we have the epidermis, okay? We have the dermis layer, and then we get into our subcutaneous tissue. So when we look at the epidermal layer, we see that the squamous cell, okay, the squamous cells are the ones that are the thin, flat cells, and they make up most of the epidermis. And they're constantly shedding. We constantly shed new skin cells every single day. And then the basal cells, they constantly replace the old cells that wear off from the skin surface. Okay, so they all have their own job to do. And then as we get into the melanoma, we see that melanoma, it's part of the melanocytes. The melanocytes actually help to develop melanin, and this is found in the lower part of the epidermis. And they make the melanin, which causes our skin to become more darker, which is hopefully protecting our deeper layers of the skin from harmful effects of the sun. And in women, melanoma is often found on the arms and the legs. Okay, in men, it could be found on the trunk. And melanoma can develop anywhere, even in those areas where your skin's not protected. So, and this is unfortunately with melanoma, it has the ability to spread to other organs in your body. Okay, so that's different from basal and squamous cell. Okay, they don't spread as go beyond the borders of their own organ. Okay, like they do with melanoma. And with melanoma, we have about the American Cancer Society estimates that in 2025, there's about 104,960 new melanomas that'll be diagnosed. And in women, there's about 44,000 of those will be diagnosed in women. And about 2,960 women will die of melanoma. Okay. So looking at our skin cancer risks, most skin cancer develops when we're in our earlier ages in childhood, when we're exposed to the environment, the sun. Frequent sunburns as a child does increase our risk for basal cell carcinoma many years or even decades later. So we may get sunburns. Like, I'm fair skinned and I've got to be careful. I have freckles. So when I was growing up, we used sunscreen, but it was very sparingly. There wasn't a lot of commercials out there and a lot of information about how damaging the sun can be to our skin. And we very rarely were under umbrellas and things, and wearing hats. So I was, exposed to more sun as a child, but we may not get the cancer right away. It may be years and years later on. And like I said, light-colored skin, freckled people burn easily, and they have a very high risk for skin cancer. And of course, the older we get, both squamous and basal cell skin cancer can arise. Okay. So cancer prevention and screening. So we want to make sure that we're checking our own skin because, again, looking at our own skin, we see this, day in and day out. We want to make sure that if we see anything that suggests that there could be a problem, we want to get to, the dermatologist right away. It is recommended that we do our skin checks like once a month. You want to check your entire surface of your body. We're going to look at our moles, our spots in our body that we normally see, okay? And then again, report those changes to your healthcare provider right away. One of the things I want to mention is that when we're looking for melanoma, there is this ABCDE rule. And it's just kind of another guide to look for those signs of melanoma. A stands for asymmetry. So if we look at our mole and we put a line down the middle, okay, we look on either side. So if we look at either side, we see that it's not symmetrical, then that could be a sign, okay? Then the outside or the borders, the B, if those borders are irregular or ragged or, it doesn't look like it's smooth on the outside, that could be another sign. C is for color. So if we see like you have a mole that's black and maybe it has almost like a skin whitish color or even brown and black, That could be another sign. Different shades of pink or red, same thing. Diameter is D. So if we look at it and we measure our mole and it's greater than 6 millimeters, which is about the size of a pencil head eraser, that could be another sign that something to keep our eye on. Okay, and then E means evolving. So if we see that over time those moles or those spots are changing, that could be another sign that this could be a possible melanoma. Okay. Other warning signs that I wanted to mention just real quickly before we get into the sun safety is that if the sore doesn't heal, like let's say you have a sore and it's not healing, that could be another sign. If it spreads from pigment of the pigment from the border of a spot into the surrounding skin, that could be another sign. Redness or new swelling beyond the border of the mole, changes in the surface of the mole. Sometimes they become like scabby or scaly if they start to ooze anything or if they start to bleed. Sometimes they can get real itchy, or they can appear as like a lump or a bump. Then that could be a sign. It's sometimes hard to tell the difference between melanoma and ordinary moles. So that's why it's so important to get to your doctor, your dermatologist, and have a professional look at it. Okay, so we can move on to our skin cancer prevention. So if we follow the American Cancer Society's recommendation for sun safety, they do have this thing that they say it's a slip, slop, seek, slap, and slide. Those are rules. So the slip on a shirt, okay, the slip is to put on the shirt protective clothing that contains tightly woven fabric, which that's the best. You don't want to be able to see that your skin through the fabric, okay? Darker colors are better than lighter colors. And then slop on some sunscreen, okay? We want to make sure that we're using our sunscreen. And just to go over some things about sunscreen, the American Academy of Dermatology recommends that everyone use sunscreen which has a broad spectrum protection, which means that it protects against UVA and UVB rays. So again, the UVA is for aging, the wrinkles, UVB is a burn, okay? And then SPF of 30 or higher. And then water resistance. Okay, we want to, especially if you're going to be going to the beach or being at the pool. And then another thing that we got to think about with sunscreen is that at a minimum, most individuals need about 1 ounce of sunscreen, which is roughly about the size of maybe a shot glass, to fully cover their skin. And depending on the size of the body, we want to make sure that we're covering our entire body to protect your exposed skin, the exposed skin. And then don't forget to apply it to the tops of the feet, the neck, the ears, and the top of your head. If you have, if you're not wearing a, like a hat, or if somebody has thinner skin on their head, like especially for men, we want to make sure that they're putting their sunscreen on their head. Also apply sunscreen to dry skin about 15 minutes before going outdoors. And then skin cancer can also form on the lips. So don't forget to put the lip balm that has sunscreen on it on your lips. And again, we want to make sure that this is SPF of 30 or higher. And when outdoors, you want to reapply your sunscreen every couple of hours. And especially after like swimming or sweating. And you just want to follow the directions on the bottle, whatever sunscreen you choose to use. And then also, the United States Department of Health and Human Services and the World Health Organization's International Agency of Research on Cancer has declared that UV radiation from the sun and artificial sources like the tanning beds and the sun lamps, they are carcinogens. So just to keep that in mind, I know I did kind of mention that earlier. And there is no safe way to tan. Every time you tan, you're damaging your skin. As this damage builds, you speed up the aging of your skin, and it increases the risk for all types of skin cancer. And then, when we're looking at the types of sunscreen, going back to that, just making sure that we use a broad spectrum protection, for UVA and UVB, that the SPF is 30 or higher, and that it is water resistant. Sunscreens with insect repellent isn't a product that the American Association for Dermatology, they do not recommend that we use one that has repellent in it. You want to apply each product separately, as sunscreens need to be applied generously and often. The insect repellent should only be used sparingly and much less frequently. Okay, so that's something to keep in mind. And then also, keep in mind that while some sunscreens are water resistant, there is no sunscreen that is waterproof or sweat proof. So sunscreen manufacturers are not allowed to use those terms, as they may be misleading. So when using a water resistant sunscreen, you need to reapply that, okay? Just to put that out there. And then one other thing to talk about sunscreens is that there's a difference between chemical and physical sunscreen. So when you look at the active ingredients in your sunscreen, if you look at, and it says titanium dioxide, zinc oxide, or both, then that's a physical sunscreen, okay? And dermatologists recommend physical sunscreens, and they're also called mineral sunscreens for people with sensitive skin. And if sunscreen doesn't contain titanium dioxide or zinc oxide, then they are a chemical sunscreen, okay? And then there's also hybrids, where you can have chemical and physical sunscreens. But really, any of these sunscreens can effectively protect your skin from the sun. But just to think in mind, keep in mind that it's got to be broad spectrum. It should be water resistant and have an SPF of 30 or higher. Okay. When we think about SPF of 30, it blocks out about 97% of the sun's UVB rays. The higher numbers of SPF, they block slightly more, but no sunscreen can block 100%, okay? And just to keep in mind that you want to reapply that every couple hours when you're out in the sun, okay? Let me see what else here. Okay. All right, I think that's it. Just to maybe for the next slide, just to keep as a friendly reminder to be sure that when you use trusted resources such as the American Cancer Society, the National Comprehensive Cancer Network, and the National Institutes of Health, and National Cancer Institute, these, like I said, are trusted websites. There are other trusted websites out there, but these are the ones that came to mind. And like I said, they have a lot of information that is very good, and it's very easily understood by everyone. So I want to thank you very much for having Kara and I. This has been a pleasure. I hope you've learned something today. If you come up with other questions, you can let Rebecca know or Lauren know, and we can certainly try and get those answers to you. Like I said, I'm not a physician or radiologist, when we were talking about the imaging for breast cancer, but I'm here to hopefully be able to answer any questions you have. Okay.
Thank you so much for joining us today and sharing your knowledge and advice to keep ourselves healthy. I very much appreciate you supporting our project.
Well, thank you.
Also, reminder, just keep yourself healthy, advocate yourself, and tell others any advice that you've heard from these meetings. Yeah, thank you guys for attending. I appreciate it so much. It's a lot of support for my project, and I appreciate every single one of you. Thank you, guys.
You're very welcome.
You're welcome.
Bye.
Bye-bye.